All right.
All right, man. Go for it.
All right. My name is Matt, and I'm the PTA and clinic director at this location here at 4951 Center Street. I have been in practice since January of 2009 and have worked alongside Chris since the fall of 2013. Dr. Chris Erickson is the owner of EHS Physical Therapy and Chiropractic and has been helping people with spine, muscle, and joint pain for 15 years himself. He is nationally certified in mechanical diagnosis and therapy and specializes in spine joint muscle pain. He believes in deeply understanding the problem that his patients are having and helping them not only heal appropriately, but find success with long term fitness and health goals. He also believes in a combination of physical therapy and chiropractic care to help people to heal faster and for longer time periods due to providing patients with the independence they need to heal themselves. He has treated thousands of patients in person and more recently helps people around the world via telehealth services to solve their spine and joint problems with online programs and coaching. I will now hand you over to Chris.
Woo! That's how we do it. All right. Thank you, man. Okay. We got through the introduction. That's the best part right there. We got through our prizes. We had a winner. Zay won, which was I can't. It was crazy that he won. It came. I think he put in some extra tickets in there. Extra tickets in there. All right. So who here would like to learn about why their shoulder is hurting them? Right. Okay. There we go. So who here also like to learn, what kind of different treatments or why different treatments and things that you've done in the past have not worked? Have you done anything in the past for that, Zay? Okay. What have you done in the past for that? Okay. We're going to get to that. No, that's fine. We're going to get to that. So, right. So really fantastic. Thank you guys for being here. I really do appreciate it because, listen, there were thousands of people that saw that ad and only the couple of you that came. So that tells me that you're action takers, not just passive bystanders. You don't want I think I want to get better. I am going to take action and take care of this thing and fix this problem. So that is a big hand. I want to give you guys props for that. You're serious. You're not just curious. There's a lot of people who are just curious, like, well, will that work? I don't know. I don't really believe it. You guys are serious about being here, which is nice. So I'm going to just introduce myself again. I'm going to go over kind of educate. I'm Dr. Chris Erickson, the owner here at EHS Physical Therapy and Chiropractic. And I want to go over some of the things that are involved in shoulder pain. So what we tend to find with this type of problem is that there can be a lot of different misdiagnoses, miscategorizations of the problem, right? So I want to talk about our process in a minute as to why it makes us different. Is it okay if I just kind of tell you about my teaching style here real quick? Okay, so this is not going to be a lecture. I'm not just going to put PowerPoint presentations up and teach. I really need a lot of back and forth. It's going to be much more of a attentive audience giving me back and forth with us. So questions, anytime you have them, just raise your hand, stand up, say, hey, I have a question, and we'll go right to it, okay? So that's kind of going to be the format. This is not going to be a lecture. There's no slides. So we're going to kind of get to that right there. And then because you are here, and I would be foolish to not at least let you know ahead of time right off the bat that because you've attended, there will be an offer at the end of this presentation for a time to work with me one-on-one. So there will be an offer at the end just to see if you want to. Some will take it, some will not. It's okay if you don't. We're still going to be friends. I want to teach you some things anyway. Okay, let me just get through some notes here on that. Okay. There, okay. So I want to tell you a little bit about kind of where I got started and how we got to this point today. So I've been doing this for, like Matt said, about 15 years. My first job out of undergraduate. So I went to school in Sioux Falls, South Dakota for undergraduate. So went to Augustana. Like Zay, I liked athletics. I played football and baseball in high school. I played football in college. I also was an athletic training major. So I thought back then that I only wanted to work with athletes. I was like, I'm not going to work with old people. I'm not going to work with, I'm not going to be a PT. That's stupid. So that was my undergraduate degree. I went on and I did that for a while. So I did it for a couple of years. I worked at a high school in Las Vegas, Nevada, and I helped all of the high school athletes. So Friday night football games, midweek, volleyball, basketball, that kind of stuff. And then in the summertime, when we weren't used because the school was out, we got put in the clinics. So we were in PT clinics similar to this, in Las Vegas, Nevada, at a company called Health South. So at that time, Health South was a large outpatient rehab company, and I did not like the way that they had used not only the athletic trainers, the staff like techs, like Kinsey was telling me about kind of what techs do, and even the staff physical therapists. So it would very much had a feel of just straight mill physical therapy, meaning a new person would come in. The lead physical therapist in that clinic that I worked in, his name was Bill Venna. I still remember it because I couldn't believe they got away with this. Like, he would come out, he'd do a very brief, like, some questions, move them around a little bit, and then everybody got the same thing. Everybody got kind of like stations. Over here, you got your hot pack and east stim for 15 minutes. Then over here, you did a couple of band things over here. Then over here, a little bit of like soft tissue work, and then like the athletic trainers and the techs did most of that. Well, Bill pretty much just sat on his computer and did notes. So after a couple years of that in the summer times, I said, okay, I know that I didn't want to be a PT, but I feel like the people that were coming in were not getting a very good service. And so I said, okay, I'm going to go back to school. So I then moved back to Iowa. I got my doctorate in Dubuque, Iowa, on the other side of the state, with the sole purpose of learning how to do this so that I could help people with these problems, and with the other sole intention of, at some point, someday, having my own business so that I could decide how people were treated, as opposed to working for a large company and just kind of getting told how to do it. So early on, there was some struggles, right? So right out of school, you have to understand that in PT school, and we have a couple of new graduates, Matt's not, but Kinsey is, we learn the basics about a lot of stuff, but we don't go deep about anything. Because you have to get people, the young professionals prepared to be in the profession. So you got to learn a little bit of wound care, a little bit of neuro, a little bit of ortho, a little bit of pediatrics, right? We kind of learn a little bit of everything. And then once you're done, then you can kind of specialize and say, well, I really like that population. I want to work with maybe geriatrics, or I want to work in the, in the pool, aquatics, or stuff like that. And that's fine. But early on then, we didn't have the skills really to get people better, like really well. Some people would get better, some would not, some would get worse. Like, okay, so what am I doing wrong here? And so that kind of went down, quite a deep dive of figuring out what's the best method or framework for me that I can understand and that I can use on a daily basis, that I can just over and over again, just kick it out, so I can make sure that the consistency and the end product is very high quality, but also that I could continually do it. And so for me, that was the MDT framework, which means mechanical diagnosis and therapy. So I went to different courses, I worked at this, I studied at this, I went through all the different levels, and as I went through that, then we started to open, Matt and I started open, we opened a clinic way back like in 13, I think he said, was that the first one? Yeah, well, we started here though. 12? Yeah. And 13. Okay. Yeah. So then we started working on this framework and kind of figuring out how are we going to get the best solution, because that's really what it's all about. Like, we want the patient to have the best outcome. So we started figuring out we have to meet them where they're at in their phase. And part of that framework that Matt and I use is understanding we can use any of the different techniques that you can learn in your courses, but it's understanding when to apply that movement. Well, first, let me back up a step. It's first understanding what you have. Like, Zay, what is Zay? Is he truly a shoulder pain? Is he a neck problem that just refers to the shoulder? Is it a dysfunction? Is it a derangement? Is it like, there's lots, right, that's right. But that's when you can't treat and you can't fix something you don't understand. So first we have to categorize it, subcategorize it, drop it into a bucket so we know what it is. And then once you know what it is, then the framework of what you want to do to it is wide open. You can take different things that you've learned from the past, you can do different techniques, and try to get that to improve the way you want it to. So once we had that framework, then we started thinking about, okay, we have to meet people where they're at in their journey. Sometimes, so think back, Zay, when we were telling that story about when he first injured his hamstring. Initially, that first couple of weeks is that very much painful or acute phase. So we tend to see people when they come into that phase, but not everybody. Sometimes it takes them 3 or 4 weeks before they even get to us, because they wait for a couple weeks, then they go to the doctor, then the doctor sends them to us, and now they're already past that acute phase. So for us, that initial phase, we call the repair phase, or when people are in active pain, right? It's inflamed. It can be constant pain. It could be intermittent pain that you turn on very easily, right? You've been in those phases. Yeah, so then once we get past that, so we need to, if you're in that phase, we have to first work on that repair phase, which tends to be around, weeks 0 to 3 is that repair phase. That's when people are in pain, and we have to fix that first. Because you can't go to the next phase, which we call rebuild, until you first repair and start to get a pretty good, hold on some of those tissues. So once we go to the rebuild phase, this is more where we're priming, that's an M, not an N, oh boy, where we're priming the tissues to accept some of those new loads, right? So you could be hurting, and then maybe you've been to a place where it's just, let's just get a bunch of external, some band stuff and exercise. It's not ready for that yet. We have to, if you're in this phase, you have to, meet somebody in that phase. Then we'd go from this phase is probably 3 to about maybe 6 to 8 weeks. And that's because that's just physiology, right? We can get people out of pain pretty quick. But if we don't continue through the process and get you past that, who's broken a bone? Anybody hurt themselves? Okay, say you've broken a bone. How long did it take for that bone to heal? How much special case?
I broke both bones.
Okay.
I guess the first part,
Were you in a cast right away?
Yeah.
Okay.
So I had one. They tried to hold together with one hand.
Yeah.
When I went back, oh shit.
Oh, wow. Hopefully it didn't move then.
It did move.
Did you lose some motion in your wrist afterwards?
So it's just a little harder than the other one.
Yeah.
Then bone infection and the drain.
You are a special case.
Yeah.
That's
I
okay.
was in a cast for like a year and a half.
Yeah. Okay, but that's okay, because that tells you, like, even, and when I was getting at that was, it takes just that long just for the tissue to heal, and the body wants to heal itself. And the reason we use casts and pins is because if you just let it sit there with a cast and a pin so the blood flow goes, right, because that bone right there is a commonly broken bone when you fall on your hand. But that little navicular bone in there can get broken or it doesn't heal well when it breaks because there's only blood supply from one side. So if it shifts a little bit, that other part will die. That's why they have to pin it. Because if it dies, you get what's called avascular necrosis, then you're in a whole different, problem, okay? But what I'm getting at here is that the body does want to heal itself when given the right circumstances and the right inputs. But even after, I'm guessing, even after he got his cast off and the bone was technically healed, you still had to go from this part here into this next, what we call renew phase, all right? So this is really where we get more to the performance part, where my arm is now smaller than that one. I don't have the strength that I need. So even though my bone is healed and the doctor says, yep, you're released, go ahead, get out of here, you're good. You weren't like back or ready or like feeling 100% to where you needed to be. Now this is the part that could take, let's say 8 weeks all the way to like, say 12 to 18 months, right? So Kinsey tore her ACL and she had the surgery. What kind of surgery did you have? Okay, so there's, Zay, for your information, this is the shoulder course, but there's a couple different kinds of ways to do that. The one way, they take the patellar tendon this way, and there's a tendon right here, and it attaches to the ischial tuberosity on your shin bone, okay? So they cut the middle third out of that tendon and a little piece of bone, and then behind that is where they put that and they anchor that in as your new ACL, okay? The other way they do it now is more of a hamstring. They take your hamstring tendon, and they scrape it out, they rip it out, they fold it up a bunch of times, and they I mean, the bone patellar bone option is a really good option. It works really well. But anyway, so yes, she had the surgery. It felt better. She started working at it. But tell us how long it took you to get back to running and playing. Okay, so this performance, anything ending in ing. So we're talking about running and then playing soccer was her sport. So how long did it take to get back to doing that? Even though she probably it doesn't really hurt anymore. I can lift my leg up. I can do things. Okay, we have special cases. That's what. No, she's the other way probably. Yeah, AP. 4 months back to playing NFL. Like that's yeah. Oh wow. Wow. Okay, 12. Yeah. Yeah. Yeah, it's Grand Island. It's not that big. But 12 weeks. So she's saying. I mean, you can't. They can't hear it. But 12 weeks is very abnormal. It's atypical to be released that soon. That's not nearly long enough for that. What has to happen in that situation is that tendon, so we're all aware of what. Like, let's back up one step on the anatomy part. Bones. We know what bones do. Okay, what do bones do? Yeah, it's our structure. So what holds two bones together? So that the bones move together. What holds them together? So the tendons attach the muscles to the bones. What's the other one? Starts with an L. Ligaments. Yeah. So, yep. Yep, cruciate ligament. So that anterior cruciate ligament holds the two bones together. The big bone of the thigh and the big bone of the shin holds them two together. And then there's muscles and tendons around the outside of them, right? So it's not that complicated, but what has to happen, again, we won't get this deep into it, is that's a tendon that's then put in place of what a ligament does. So your body, it's amazing. Your body breaks down that tissue, rebuilds it back up, and it now becomes a ligament, even though you put a tendon inside of there, where a ligament should be. But your body recognizes, okay, that's not what it's supposed to be. It's there. I'm going to change the structure of that, and I'm going to make it into a ligament. But it takes months and months before it's really strong. You'll feel strong. You'll be okay, I can do stuff, but she wasn't ready to like play at a high level yet. Is what I'm getting at. Did you wear a brace right away? Okay. Yep. Okay. Yep. All right, so then tell me if this sounds familiar. Here's one of the reasons one of the deep reasons that Matt and I do what we do. We really get frustrated when a person like, and I'm just making this up, so you tell me if this is off. A person like Zay has a pain, goes to the doctor, says, okay, I understand, I think in my mind that this is the way it's supposed to go. I go to my primary care doctor, right? I sit in the waiting room for 45 minutes just to get into a room where somebody comes in and they give me maybe 7 to 10 minutes of their time. They're typically they're not really even asking me very many questions. They may or may not even move your arm. It may just be like, yeah, my shoulder hurts. How long has that been there? Oh, a couple weeks. They usually write you a prescription for a medication. Everybody's got to have 800 milligrams of ibuprofen. IBs, right? So 800 IBs, boom. They probably will get you some kind of advanced imaging, usually an X-ray. And let's just say, because he's a young man, in his early 30s, I think he said, right? So if you don't have an accident, there's no trauma, there's no reason whatsoever. But what are the first thing to do? Let's get an X-ray. And it comes back, oh, your X-ray looks good. You got a strain. You got a muscle strain. Because they don't know. And then it's like, okay, so you just wasted $150 on an X-ray. You got a prescription you probably didn't need. And then they may or may not send you or refer you out to either conservative care like physical therapy or chiropractic or maybe an orthopedic. More than likely they'll just say, go home and rest for 2 weeks. Let me know if it still hurts, which is terrible advice. So that's what happens is we don't get people that we can help until all of these things have come down the line. Even worse is if they go get, like, say, a more expensive advanced image like an MRI. So that's another $1,000. And then it's like, well, yeah, I have all these things going on in my shoulder that may or may not be relevant. It may have always been there and it was never a problem, or it could be the thing that's causing the pain. It's just not a very sensitive test that way. It's sensitive in the sense that it shows a lot of things. It's very sensitive in its ability to see what's there, but its predictability or reliability of what the actual problem is not very, very reliable. So I don't know if that's happened to you or not, but that's some of the things that we hear quite often, and that's what makes us quite frustrated. Yeah. 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 So we're and there it is. Yeah. But that's all they're going to do. I mean, they don't, and that's okay. Everyone has their specialty, And this is what we have chosen to really, dive deep into or dig deep into, is what we call mechanical spine and joint pain. So mechanical meaning it hurts when I do this, it doesn't when I do that. You can turn it on, you can turn it off. Even if it's constant, at least it changes based off of time of day, position, activity, movement. Right? I'm worse if I sit. I'm better if I'm walking around. It's bad to sleep on this side, but if I can kind of position it a certain way, then it's better. That's mechanical pain. And when you go to a general practice physician, they don't know that. It's just basically, it's either a disease process, can I fix this with a pill or a prescription, or can I not? That's all that really, and it's those fall into not. And so they just, you're in the wrong place. So we really have to understand what the right vehicle is. How can we get Zay on the right vehicle to solve the problem? And if we're in the wrong vehicle, it lasts for a long time. And that's what could happen to that hamstring, is that your body, like we talked about, wants to heal. It just didn't have the chance to heal properly because you didn't get in the right vehicle. It just, I didn't do anything about it. I got some injections. Yeah, I calmed the pain down, which we can do pretty quickly. There's a lot of, like this part here is fairly easy. I mean, we can calm pain down pretty quickly. But if we can't get past this, then the pain will come back. Yes. Yes, there we go. Yeah, and never even got out of pain. And you can't start doing these things and yeah. And then, but if it's not healed right, the cycle will repeat itself again. So we got to get through that phase to that phase to that phase. Because this is easy. You can just get you, like I said, a shot of morphine in the butt takes the pain away. But that doesn't fix the problem. I mean, it's an easy solution, but it doesn't fix the problem. So that's our tactical kind of framework of how we, do these things. So here's what I want to do next. We're going to pick a volunteer, and I bet you can all guess who it's going to be. Because Zay has been so kind and generous to volunteer, we're going to take a look at his shoulders. So everybody stand up. Let's take some stuff out here, okay? Let's move around. Yeah, we got to move. We need action. We need some energy in the room. Okay, here we go. So left shoulder is the one that bothers you the most, right? Okay, so let's just see what we got. So right arm all the way up. Okay, so it moves pretty good. Actually, come over this way. We're going to do it all together, but I think we can do this way. Okay, so like this. So this one all the way to the front. If I have a little bit of extra like pressure there, is that pain or is that just pressure? Okay, come on down. Then come to the side, that way. All the way up to your, yep. Yeah.
You heard it too, didn't you?
Yep. Okay, anything there? No. Nothing there. Okay, come on down. Left arm, straight up front. All of that. See, that's okay. So you go as far as you can. About there. Okay? If I had a little pressure, what's that feel like there? Okay? Come on down. And then out to the side. So about 90. That one doesn't go much. If I help you, it will, but it's...
So at 90,
yeah.
It's kind of armpitish.
Deep inside there?
Yeah, and then just the further it goes, yeah.
Okay. Come on down. Come on down. Do you ever get any symptoms like up in the shoulder blade up here, down here, or like down into your arm? Or is it only there?
So I get on my left shoulder blade.
Yeah.
It gets a nagging.
And you can see these. You can see these scars here.
Oh yeah, it's terrible.
Yeah, they got your wrist all, man. Okay. So you will get some pain in through here.
All the time.
Okay.
Like,
sitting, standing, working on the computer, because he does work on the computer now, right?
Sitting. So I'll get that, and I try to put the chair in between my
yeah,
shoulder,
that pressure on that spot.
Yeah, I get that, or I get my just back.
Okay.
Yeah.
When this is increased or the volume is turned up some on that one, do you feel like it affects the way your shoulder moves or not? Or does it affect the way your neck moves? Like I can't turn as far to the left, I can't look up or down as far, or not?
No.
Okay. You just feel it there. It increases, but it doesn't radiate anywhere else.
It's because I'm kind of I did a body scan thing, and I'm kind of I guess my body favors leaning.
Okay.
This way.
To that side.
So when I try
your distribution of where you stand. Okay.
Yeah. So when I try force myself to stand straight, all of this starts to hurt. My shoulder blade starts to hurt back here.
Okay.
So everything about my posture wants to pull me into this side like this.
Yeah. Yeah. So that left side, and he's had some previous injuries on that left side. We talked about him a little bit earlier before. I mean, it never actually came like where your shoulder came out of socket, but there you would get that feeling of like a, and I'll make sure I understood you right. I'm going to call it like a stinger, where when you tackle, you'd get like like a zing down the arm, and it would kind of be numb and dead, and then you would come back.
It's like just instability. So like even like here.
Yeah.
Like have to put it back.
Okay.
It's
So just let that relax right there. Does it feel like it's fun to be like kind of rotated out that way?
well when my arm is less than like 90.
Yeah.
I'm perfectly fine.
Okay,
with
so
the
up here it goes.
Oh yeah. Yeah. That's
Okay. Yeah. Got pretty good motion. Bring this one up behind your back. How far does it go behind your back? Okay, about there. Yep. Okay, put that one down, and then go with your right one. Yeah, that's about equal. So there's not a big loss of that one. How about shoulder extension? Let's just bring it straight back this way. It's a little tight that way.
oh yeah, fine.
Yep, that's just a little tight that way. How about this one? Actually got pretty good extension there. Yeah, it's pretty good. Okay, so you mostly feel pain like in here in the shoulder and back through here.
So like one time I remember going to the cattle base and like
Yeah.
so he puts my arm
Well, I thought I had to if you're in the middle. Yeah.
like, like this and then like I guess like he stood behind me and grabbed like my forearm.
Yeah.
And then like just pushed it.
Yeah.
And he was like it's just
Okay, so getting into this position to do a pull-up is difficult,
yeah. So if I do if I
especially if it's above your head.
if I want to do a pull up, my shoulder is like it's not on the like it's like almost like an archery, so I have to like get, like force my
Okay.
shoulders forward
Okay.
to where I can. As
Yep.
long as it's here, I can't. I have no. I have zero
There's
strength,
no power from that spot.
no
Okay.
strength, no anything.
So you have to really kind of bring it forward a little bit. Okay.
Yeah, I'll just get back in.
Okay.
And then I can, but
Okay.
it's so heavy.
Oh, pull-ups are hard. Pull-ups are hard. Ask Matt. Pull-ups are hard. Huh? Yeah, we can test it. Let's test it. Because what we want to do is get a couple of like actual baselines, and then we can try a couple of things, and then we can retest it and see if it's any different. So don't fall on that. Matt, were you doing some 5-pound curls there or what? That's your dad.
No, I do something like that.
55-pound deadlift is what we got there. Let's move that. Oh, I've got to get this further out of here so I don't want that hanging in your face necessarily. There we go. So hang there. And then what we'll do is try to see if we can kind of set those shoulder blades more back. And then from there, we can kind of see what happens with that one there. And then we can always just retest it.
So
Oh, yeah.
it's like
Yeah.
I have nothing. I have to like I have to.
Yes, internally, yes, kind of rotate, externally rotate
So
that
right
out
here,
that way.
It's like it's not much forward.
Yeah.
I have to come here.
Okay. And then, okay. Yeah, it does shift a little bit. It shifts a little bit. So the wider, the harder it is.
Yeah, so that's
Yeah.
what I was saying. Like when wide, like there's no chance.
Yeah.
Wide, but it's just like it just wants to flare out.
So, yeah.
Like, I have to try to like.
Yes, yes.
But
Try that again. So we kind of come forward, and then pull. Yep, and then pull up. They feel pretty they feel pretty good there. It's something a little bit maybe deeper inside there.
we need to get up there. How many more examples I gotta get here?
No, good. Okay, good. Come over this way. That would be easier, I think. Yeah.
All righty, here we go.
Yep. It'll be against the wall there. It's fine. Chest there. Yep. And then just pull yourself up.
So like out.
Yep. If you want to. Yeah, if you want to put your feet up on that bed. Yep. But eventually when you pull yourself up, your feet are going to come up off there.
So, right now.
Yep.
Right there. Now,
Yep.
now I'm in.
Yep.
And then I can-
Okay.
but if
So
I
it never actually comes. It just slides enough that it's like a little subluxation. So we're gonna have to work on some of those to maybe activate some of those humeral head depressors and keep that thing in there. Okay.
my arms are depressed.
No, some of the muscles to keep that in there. Okay. Okay. All right, come over this way. Let's try a couple things. That was interesting stuff. Interesting stuff. Yep. The first thing I want to test is, because I think it's important for you with what you do for when you were a truck driver, when you were working at what call center. So work for you is mostly sitting.
Yeah.
Now. Okay.
I'm gonna be honest.
Well, sit nice and high for me, nice and tall. Here we go. All right. So I want to see if we can change any of this, with some movements here first, because you would be surprised. Again, it's not your fault, but at least 50, maybe 60% of people who have like scapular or like shoulder, arm pain, it's a neck issue. It has nothing to do with the shoulder whatsoever. Once you move here, that all goes away. Some still have a little bit of a shoulder issue after, and then we can, fix one first, then the next. But it's very common that we get people that come in and said, I've been to this place. They looked at my shoulder. They say I have all these things going on, and it's never better. And then once we start working here, then it goes away, gets better. So that's interesting, and it's a surprise. I don't think that's the case for you necessarily, but I don't want to assume. We have to test it, right? Got to be scientific about this and test it. So turn to the right with your head. If I give a little bit of overpressure this way, is that just a little bit of like tension or stretch? Nothing wrong there, okay? Go left, like that. Good, okay. And then tilt. You didn't feel anything when I went left that way? And then go left this way. Anything more than just a regular stretch, nothing that's turning pain on at all. Okay, head down. Okay, and head back. Go far, 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 far. Anything back there? Okay, okay. So he's got really good neck motion, but I think there's something there since that extension turned that on a little bit. And I want to see if we can get that thing to move better and take that pain. I wonder if it will change with, the way you have to kind of clunk your arm to get it to, we'll see, I don't know. Let's start here. Bring the chin straight back right there. And then once you're there, then let it roll back. It'll feel different because it'll be lower. It might even turn that shoulder blade pain on a little bit more. What'd you feel doing that one time? Yeah, okay. So keep doing that one. So the key is you have to tuck in here first. Then as you let it, nope. Once you're there, then let it roll out. Let your chin come out. You only tuck it to kind of prime these joints back here. And then once you let it roll back, then it just, because like if you look at my head, if I just let my head roll back this way, I move a lot from the upper, where those kind of wrinkles in my skin are. But as soon as I go back and then roll, I move from a lower spot. And then think about what we do when we sit, right? They already showed us. We're this way and we're protruded forward. We're here. And that's upper, it's just, we do it. It's really easy to protrude. It's hard to do this one. We're able to move this way, but nobody does. So let's see it. 10 times here, yep, and really go back. I mean far, 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 far. Way back there and come back up. And it'll loosen up as we keep going. Tuck and roll. Way back. That's good. A lot of times, that's the other thing we can get into that I don't know if we were going to get into that or not, but what does a good pain look like? What does a bad pain look like? Many times when something hurts like that, we've kind of been taught that if it hurts, don't do it. And even when you go to some different providers, it hurts when I do this. Oh, just don't do that. Just stop doing that. It's not always true. I mean, especially you kind of felt that. We're like, yeah, I had pain when I was here, but then when I stopped, it quickly went away. It wasn't any worse, correct? Okay, and then as we did more and more reps, because it wasn't a red light, it was a temporary pain. It was a little bit, something kind of happened when I was there, and then it's gone when I stop. That's not wrong. But then when I keep going, it actually went away. Feels better. But you'd never even get there and know that unless you actually test it out a little bit. All right, 2 more, and then we're going to stand, and let's just see. Move the arm around. Try the pull-up thing. See if it's any different. If it's not, that's fine. Then we just know that the majority of the problem is not here. Then we move to here. But if I skip one whole step, then you're going to miss at least like 50%. And that's way too high. There was an XPOS study. That just means it's an acronym for extremity pain absent of any kind of like spinal. So you can have what they studied were people who just had shoulder pain, or just had knee pain, or just had ankle pain. No other classic referred symptoms like, well, yeah, I have back pain and leg pain, or I have neck pain and arm pain. And they found that even without any kind of scapular or any kind like that, 40% of shoulder pain. Shoulder pain alone was neck related. So, I mean, I can't take that. Like, if you see 10 people with this, you're going to miss 4 to 10. That's too many, right? That's too many. I can't live with that. So we got to test it out first. Knee too was like 30 to 40% of just knee pain was from the back. Again, that's how many people go get, oh, I got to get meniscus surgery, and they still have the pain afterwards. Okay, stand up. I mean, it doesn't happen all the time, but it happens enough that we have to like think about that. Or, I don't think this is you necessarily, but they'll go in and they'll get a shoulder like the old rotor cup is bad, right? And they get the surgery, and then they come and we do all the rehab, and now that pain's still there because it never was the shoulder. It wasn't the rotator cuff that was bad anyway. All right, retest. So just facing me again. Right arm all the way up. That was our baseline. We know that one was good. No problem there. Okay. And then down to the side with that one. Yep, that one moves fine. Okay. Left, straight forward. Does that feel like it's any different? Does it feel easier, feel harder, feel the same? Felt a little better to move forward that time. Okay. Now the biggest loss for you was that side one. You really felt it about 90. It was like, you could go, but this was a little something weird there. So then from there, just thumb up. Yep, like we did. Yep, thumb up and just swing it on up. And that moves a lot better that way. Okay, so that's good. There's still a little bit of something up there. Okay, worse than it was before? Same or better?
It was better.
Okay, so a little bit less than before. Okay, let's test this again. So I think there's still something going on in the shoulder, but I think there's still something to at least explore further here because it was a little bit different. So, do you want to try it here or do you want to try it on the total gym? Which is easier? Well, I mean, I know what's easier. Yeah. I know what's easier, but he's like, I'm a man. I ain't get on that total gym. That was for who was that? Like, yeah, and Jane Fonda or whatever. So, yeah. Yeah. Just see if it makes it any easier or if it's still the same. Yeah. I mean, I think that's kind of just the pattern that you've used for so long that we have. Did it feel like it was any different, any worse, any better, or the same?
There's actually like normally like there's like a I don't know like tension or pain in like the socket.
Yeah, yeah, like deep in there in the armpit.
But now it's like
Yeah, it looks smoother, which is okay. Let's go try it again. I think I want to go a little bit lower in the upper thoracic.
oh man.
Yeah, easy, all day. All right, so I want you to do that one again. I'm not going to help you this time, but you still got to stay tall in the chair, right? Because otherwise it won't work very well. You got to stay nice and easy in that. There we go. So you do that same thing. You're going to tuck, roll way back, and now with your right hand, put pressure under the chin a little bit. Yeah, let the left arm completely. We don't want that thing to skew our result at all. So just leave it down and then come back up. So 10 more that way, and then I'm going to try a couple. I think upper thoracic. I'm going to mobilize him through there a little bit, because that for him, I think, because he's tight. Yeah, we got it. That upper thoracic will get a little mobilization, and we should be able to get some change through there. Thank you. Okay. So this is we're to that. I'm a little behind schedule because I talk too much, but that's okay. We are practicing, and we really appreciate Zay for helping us out with this. About 10. Yeah. Then we'll really be behind schedule then. But I mean, maybe over the next couple days. Yeah, maybe over the next couple days. But yeah, I always in Spanish my favorite one is 200,000. 200,000. 200,000. Yeah, they always like, what? I'm like, no, just yeah. Yes, how? ¿Cuántas veces? 200,000. 200,000 reps. That's a lot. Oh, that's going to be very funny when she goes into that. Yeah. Because we'll talk about Robin. Like they'll say, oh, Robin did it, or Mackenzie did this. And she's like, I did not. I didn't do that. Okay. Now scoot your body forward. Like move your body to the front of the chair, but still sit tall. Because I'm going to come behind you here. Yep. Bring your hands up kind of behind your neck and shoulders. Just kind of rest them like that's fine, and then bring the elbows to the front. And you just come with me. So just come up, 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 up. Yeah, and through there. So I like this technique. I don't know if you use this one at all, but I like to use my leg as the anchor, because I can use my bigger hip muscles to really apply a force of like anterior and superior at the same time. Yeah, to kind of go along those, because those facet joints in the thoracic are really kind of anchored at that kind of 45-degree angle right there. So.
I'm not gonna lie to you.
But what happens is this upper back gets a little bit tight, and it's amazing how when this doesn't work quite right, that then shoulder function doesn't work quite right. And I don't really know why. I just know that it does. It just changes it. That upper thoracic and lower cervical spots of the spine, when they are kind of not moving correctly or dysfunctional or have little whatever derangements, they affect shoulder motion. Okay, I know. Okay, so come on up, and it might do that. Okay, come on up again. Stand all the way up today, and then retest the left shoulder all the way up. Okay, good. And then actually turn this way for me, and then go to the side all the way. Thumb up, and all the way up to the top. Yeah, it's getting further up there. Yeah. I mean, before it was down. I mean, so we're getting further. We didn't lose anything behind the back, did we? So come behind the back again. Oh. Yeah. And then go do right hand. Wait. Okay, so turn around. We didn't do that one. So the left, before they were the same, they were down here. The left one is so that's your right one. Now do the left one again. And come up there. So now you're past that. Yeah, so that's the left one, and the right one's down here. So, okay, so that's interesting, because I did not expect it to make more internal rotation, but.
Right, yeah. Does that tell you more that it's like actually coming from the back?
There's at least some portion of it coming from there. Yeah. Yep. But like even if he gets, let's say, I mean, if we plateau, and I'm just going to make it up. After, let's just say we start some treatment, we work on you with this. After 2-3 weeks, we're like, okay, I'm 75% better, but there's still something not quite right. Okay, then we have to look at the shoulder. Something else is there. But what makes it confusing is if we just zero in on one thing and we don't, then we could miss, we could miss a large portion of it, or we might miss even, say, 25%. And then like, well, I never really got fully back because we didn't check all this stuff. And I think there is something going on with the shoulder. Like this typically does not explain that shifting and moving pain. It definitely, I've seen it where it's like I can only go this far, we work, all of a sudden, whoop, there it goes. Like it's dramatic changes. And his was pretty dramatic from here, like ouch, to it just yeah. And then try the pull up again. I agree. I didn't even move it that much. I moved the upper back a little bit, but yep.
All right, so I'm not doing lats today, but I get to the gym.
No, you got your back workout in today. Okay, pretty good. And so that's a dead.
That was the
What about like
and that felt good.
Yeah, that was a dead hang. That one. That was.
And I can actually do it. Like it's still, but
Yeah,
normally,
yeah. From there,
I mean, I'm crying. Like I can't hang.
even just the dead hang.
like you can do like a T-Rex.
I would start to try to get those like the shoulder blades, because what we want to do to get a really good pull up is you got to get those shoulder blades like depressed and back, like depressed meaning down, not sad. Like once you get these things kind of set and back, then you can use the big muscles of the lats, and then rather than just pulling with biceps. So from there, yeah, kind of bring chest up and pull these shoulder blades down to your back pockets, like you're gonna do a lat pull down.
Well, my hands up.
Yeah. Here, come step off this way just a bit, Zay, right here, with your left arm. Oh, watch don't fall. Falling is Matt's deadlift bar. Falling is bad for business. So from here, just try to pull that thing down and back. Pull your left elbow towards your back pocket. Down and back. I want to get that lat kicked in a little bit. Yeah, really down and like from here, really down and back through there. Yeah, you want to feel like right in there.
You're putting your Platinum American Express in your pocket.
Yes, that. Cha-ching. The black card. Yep. Yep. No limit. No limit black card. Yeah.
Where do you feel it? Like, where do you feel it?
Well, the fact that I was sore.
Yeah.
Everything kind of
Yeah.
moving it.
So what? But tell me, yeah, tell me about like the pain. We've only been doing things for maybe, I don't know, 10, 15 minutes. Does it feel like the pain is different? Is it more pain? Like more soreness? Is it less pain? Is it the same? Is it doesn't hurt any different? It's no different.
So it's definitely less because like certain things like it's just kind of like aggravating.
Yeah.
But now it's like certain angle like pull up
Mhm.
certain like angle when you first get in maybe I went too far.
Yeah.
Then come back a little bit.
Yeah.
But the movement itself.
Okay. It's pretty good. All right. So that's kind of some of the stuff that we would work on. Anything else you want to try on that one, Mackenzie? So as far as like some scapular or shoulder stuff you want to look at?
I thought it'd be interesting to see him do some prone stuff.
Okay,
But,
let's go try it. Let's go try it.
prone, like,
Like horizontal abduction kind of.
like a little IYT.
Okay. Yep. We can either do it prone. We can do a TRX bands, whatever you want to do. Let's try it. Let's try over that. You got that, Matt? Let's go right over here on this table right here.
Oh man, not the morphine shot.
Right in the butt. Kind of scoot to your body to the left side. So that no, the left side. Your other left. Scoot your body to the left side so your arm hangs down. There you go. So what we're gonna look at now is Kenzie wanted to look at a little bit of some shoulder and some scapular movements. So one thing that we could try to do is take. Do you want to go more like back of the hand and just kind of try to bring that shoulder blade more towards? So okay. So don't worry about the weight at all. Just the weight of your arm, and just really concentrate on bringing this shoulder blade back toward your spine. Pinch that together, okay, and then back down. So go ahead and do that, and go ahead and push up and get it over there like that. There you go. Keep going. Get it over there. Yep. So we know that he has some pain here because he told us he has some pain in this vertical area, which is a very common spot for a problem here or a problem here. So then keep going. Up. Yep. Okay. Thumb up. Yep. Go. There we go. Get that rotation. Yeah.
Yeah, I'm
Up
like,
and down, up and down, up and down.
cheater.
Yeah. Well, I don't know if his wrist will even let you turn that much. It's shoulder? Okay. Okay.
It's like burning.
Okay. Okay. Yep.
Might be a gym exercise.
Yep.
Yeah,
Yep.
it's a good one though.
Yep. 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 And then back down. Just back and forth. Yep.
Ooh, good. Muscle food.
There we go. I like that one. It's interesting. I think kind of a takeaway or an aha there is just sometimes just the rotation or the change of the angle can be.
That's what I like.
Yep.
What about if you do the like sorry.
A little bit of an angle. Move that basket, but like a 30 degree angles there. Like that. Yeah. Then we work more low trap. So
That's all I got.
yep, that's good. This one's gonna be harder than the other one, yeah. So keep going down.
That one was the warm up.
Yep. So let's just get about 8 or 10 of these and then we'll try to just kind of get that lat going a little bit. Yeah. Because that lat's a big muscle, and that lat should really help center that shoulder, like the ball, right? It should help center it in the socket. So.
It's burning the joint.
Yep.
Whatever muscle that uses to lift it up, I feel like I'm lifting 40s right now.
It's just your arm too, huh? Crazy.
Oh, sweat.
Okay. All right. All right, come on up. Try it again. You got another one?
Oh, I was just gonna do the one in front.
Okay. Go forward. Yep.
You might have to maybe scoot your legs to the diagonal.
Like that. There you go. Just get more room so you don't hit the table. There you go. There you go. Okay, get some that way and then we'll head. It's tough. It's tough.
I know, you're proud of you.
I feel like it's more than
It's like you're
It doesn't when we're lying down. Don't worry.
Right. No, you're doing the best you can. This is where we want to work on all this mobility through here. So we already worked on some thoracic and cervical. Now she's kicking in some of these posterior muscles along the shoulder blade.
The
So
moneymakers.
yeah.
Woo.
Yeah.
Woohoo. Are you tired? Cheating?
Am
One
I
more.
sweating?
One more.
Is that what
Cool.
you said?
You're done.
Okay, come on up. Let's try it again.
Good job. I sweat. You need a towel.
Get it. We got waters. We got waters. All right, let's just test the motion again.
Here we go.
Okay,
Sounds good.
that looks good.
Side.
Yep, that's a left arm. Yeah,
Yeah. Hey,
yeah. Hey, don't, yeah, just nice and straight, just all the way up, or as best you can. Yeah, that's a lot. Yeah, that's almost to it's almost to his ear now. So, okay. Woo! Well done. Well done. Any armpit pain?
no.
Okay. Try the pull up again. So really try, like I said, we really want to try to get when you're here, before you get to that dead, because you're tall enough, just you can be on your tippy toes. So that's that dead hang. Don't start there. Try to do what we did over there on that table and pull them shoulder blade down until you're to your
Okay.
pockets.
Chest is on the bar.
Yeah. So kind of tip up a little bit
Okay.
and pull them because from here to start it's difficult. You got to get that kind of like there, and then from there you can use those big muscles to pull from there rather than there. So get to that part. So kind of get that shoulder blade set and then pull up. Yeah, then he can work. He could work on just pulling the shoulder blades back. Yep. I think he's a little taller than me, so it might have been a little bit easier. But she just out deadlifted you, Matt. Yes. He's gonna get that chest pulled up, and then you're using these to pull instead of those to pull.
Those are weak too. So we're gonna get
Was it hard or did it hurt?
just my arms.
Oh, they're just tired. Yeah. But how did it feel pain-wise? So or at least the feeling of shifting in the shoulder, is it different?
Yeah, I didn't do it.
Okay.
With my chest up.
Yep. There you go.
I'm just stroking and doing it.
Yeah.
It'll work.
Yep.
It'll work.
Okay.
Catch me on the first one.
He's fatigued. Just give me a second.
Catch me
Okay.
on the first one, Mark.
All right. Give him a hand, everybody. Give him a hand. Zay, that was excellent. That was excellent.
Man. Like that. I don't want to call it a hack. That was nice.
Okay. So do we have any questions or takeaways or ahas from doing that stuff right there? I mean, what did you think, like in your head, like, okay, what's going on? Why is this changing? Like, what questions do you have about what we just did right there?
I don't know. I just should everything to voodoo.
Matt's back there with the voodoo doll. He's like working on.
And then I'm like, and who am I then?
Yeah, well, we're witch doctors.
And so, like, I've done a little bit of I guess like physical therapy on,
Yeah.
on the joint.
So tell me what they did in the past, and then if it's different.
What was crazy was like even while like doing the things you had me do,
Mhm.
like just the movement of arm, like it was like the things I would normally feel when
Yeah.
doing these, it was like those muscles. I could tell just from trying to squeeze these, like how weak
Mhm.
the muscles are here as well.
Mhm.
I'm like, okay, I'm figuring some things out.
Yeah.
But like shoulder was a big issue, but what that thing there, I wasn't even in. Come here for him.
I know,
Shoulder blade.
but I think that you
was-
notice that when you're sitting, like you said, at your desk, and not knowing, and it's not your fault because it happens. We get it all the time. Not knowing that there's a significant and definite relationship between shoulder blade pain and the inability to like move the shoulder well they're related almost always. I mean, it's rare that once you get that moving, people are like, oh yeah, it's just a lot easier to move my arm now. And you had that pain. I think that was from the stuff that you'd said, like the truck driving, the working in an office and a computer for hours a day. You get kind of rounded here, right? A little bit sunken in the chest, a little bit tight here, a little bit weak back there. The head comes forward. And so I started with some of that, and then Kenzie kind of added some of the other ones that we wanted to kind of get you this way a little bit more. So the combination of the two, I think, will work for you to get you back to all the things you want to do. Well, he was not in the repair phase. He's not, and he was right. He's not the pain phase. He's in that rebuilding phase. We have to figure out, like, because he can do stuff. He's functional. He works out. It's not pain all the time. It's just certain things like, ooh, what is that? So once we get them a little bit of a plan for home, you can do that in the gym, like before you work out, part of your warm up, and then work out, and then after you're done, as part of the cool down, do it again, just to get things reset here and to get things reset like in that shoulder. There's a couple spots there we got to work on. All right. All right, then I think I will probably wrap up. What else was I going to say? Yeah, what else was I going to say here? I'm going to practice here again. Yeah, other questions? Yeah. Well, Zay wrote one down. What's Zay's question? I think the answer is yes to that one. Yeah. I mean, I know, because usually when surgery is the right answer, it's really effective. But usually it's because just you have to, like, we'll go through things, we'll funnel it, again, we want to funnel it down to what's it causing it, what's the problem, and what's the best solution for it. And a lot of them end up in the bucket that we can fix, but there are some that just can't. I mean, just you need it. And when you need it, it's really effective. But what we try to do is we try to help people that don't need it avoid an unnecessary one, and help people that do need it to get to the right person. Because I can't. The person that needs to fix that is the person with the scalpel. They do a really good job with that. They're experts. But not everybody needs that. Probably 10% of shoulder. I mean, what would you think? I mean, it's not a high percentage. Yeah. Most, I mean, like I said, the body wants to heal on its own. Most people, if they either give it a few weeks, it calms down, and then they tend to fall into that bucket of it didn't quite heal right, and they have maybe just some dysfunction or pain later. Or if we catch them right away, we can get them in that painful range. But sometimes like this kind of thing here, right? This required surgery. I mean, you fall, you break. Yeah, I mean, you had to. Yeah, if you didn't, you would have had a much worse outcome if you didn't get surgery for that wrist. But for this kind of thing, it's probably not a surgical thing right now. Okay. Smooth like butter. That was the baptism. Baptism by fire. Just do it again. Let's do it again. That was a good one. Yeah, how'd you do it? Yeah.
So I actually learned it if you have a nice like the integrative ring.
Yeah. Yeah. Yeah.
I have left shoulder. I do it like this way, so you have like this.
Okay, that's fine. Yeah, that's fine. Yeah. It's like that's the same way you do on the wall. Matt does it on the wall that way. Yep. I like to do it that way on a bench. Yeah, I like it like this, and then you can really, and then she can just stand behind. You can really get that to sink in that way. Yep. And I just use my, so then scoot forward with your body. Yeah, then you just get your elbows up. Bring your body forward again, way before. So I use my leg, and then I can control the movement with my hip and like internal rotators, and that way I just prop the spinous processes right between the thenar and the hypothenar right there, and then so you put your hands back up there where you had them again on your head and neck, and then I come and scoop in here, and then I'm just kind of, as I'm going up, I'm also pushing my leg in and up, like through there, and I don't get as tired using my leg as opposed to if I have to use my hand. There's no way, because he's a big guy. I have to really push force through there, especially thoracic. And then I can add some rotation, like for him, like over to the left. Yep. Rotation. I can really get. We do.
Yeah. Oh, that's an inside joke. I'd love to be
That-
part of one someday.
That I know that program.
Michael Scott.
You could teach a whole like college class. I mean, that stuff even in like modern offices, old, it's the same. Like it's evergreen. So
Some of it is so.
all right. So I'm gonna practice my wrap up, and basically I was just gonna be like kind of breaking down some of those beliefs of like, and so what we're doing is we're talking about that the model that we prescribe to now is more of that biopsychosocial model, right? So we used to think in the past that in order for you to have pain, it had to be something physiological, like a tissue had to be hurt, a tear, something had to be causing that pain. But we now understand that people can have pain without like having a bad-looking MRI or scan, because the way our brain and our body is tied together in that biopsychosocial model, if you believe this thing will never get better, it's the worst shoulder in the world, I'll always have pain, I can't, don't touch it because it's the worst, it will stay that way. Like, even no matter what I do to it, if you don't believe that you will get better and like actually have a result, or have even the chance for a result, it's a waste of time. I mean, we won't actually make any progress. But those that do believe, like, hey, I think I can, fix this and have a little bit of chance at doing this, and they stay consistent with it, and they work at it and work at it, it will work. So think of it like, I like to think of it like there's just certain laws in nature that you can't get away from,
Above,
right?
so below.
As a what?
As above, so below.
Yeah, that could work. Yeah. Well, there are certain laws, like laws of nature that we can't. I mean, we're humans. We live in the natural world, right? So some of like Newton's laws, like an object will remain in motion unless it's acted upon by another outside force, or an object will remain at rest unless it's acted upon by an outside force, right? So if I don't do anything with this shoulder, I'm not going to make any progress with it. And just like if things at rest will always deteriorate or go into chaos. If I don't cut my nails, they get longer and they get all nasty. If I don't cut my hair, it gets longer, it gets all nasty. If I don't go to the gym, I get weaker. Like if I just rest and don't do anything, I will go into chaos. But also the law of nature is things have to go down before they go up. So when you plant a seed, it doesn't just sprout into a big tree. Its roots first, down first before up. Same thing with think of I don't know if you guys know this, but bamboo grows very fast. Like the bamboo, like those shoots of like grass. Bamboo is kind of grass, but it will take 4 to 5 years to grow roots first, and then it'll grow like 20 feet in like 30 days. After it takes all, but you have to go down first and establish like. Same thing happens with a bird that falls out of the nest. Like it falls first and then it flies. Everything in nature goes down first before it goes up. Like when I broke my wrist. It's really bad right away. All right, I have to have surgery. I can't do anything with it. I'm down first and then I go back up. An investment. I buy an investment house, right? My bank account goes down first. I have to put the money down before it goes up when I get the return off of that. Everything in life goes down first, then up, right? It's just like we open a clinic here, we open another one. My bank account goes down first, and I hope it goes up, but eventually, hopefully, it should go up. But it goes down first. I got to buy all the equipment. I have to hire, right? Everything in life goes down first before it goes up. So same thing with this thing. We have to kind of anticipate that there will be occasional setbacks or occasional little okay, kind of flared up today. It's not wrong, or it's not like okay, it's broke. It's never going to work. It's the worst thing ever. It's just part of the process. It just goes down, comes back up, goes down a little bit, comes back up. So that was the one law of nature that I wanted to talk about. And then I think then the only thing I had left was just the offer that I mentioned in the beginning. So like I said at the beginning, at the end, I'm going to offer an opportunity for you guys to work with either myself or our chiropractor Drew or Matt. So we're going to see what, if anybody had that desire to do so. I don't know what that is. What are you doing? Well, so if you want to work with us, this guy say, head to the back with Kinsey, and we'll sign you up for an eval.